Okay, guys, now about information technology, several points. You have to know that, my dear students. So, the vast majority of hospitals and clinics use electronic health records, my beloveds. Now it's like this. So I don't talk about it's okay, it's not okay. So as future physicians, your interaction with information technology will extend far beyond simply typing notes. Health and information technology is a critical tool influencing diagnostics, treatment, patient safety, communication, and research. So you have to being proficient and aware isn't just helpful. So it's becoming a core competency. So I repeat, the vast majority of hospitals and clinics use electronic health records now, so-called EHR. EHR. So in many developed countries, adoption rates for electronic health record, EHR, or electronic medical record, actually it's the same thing. So these systems in hospitals exceed 90% as last data. And rates in ambulatory clinics are also very high. So these systems are comprehensive digital versions of patients' paper charts. So why it's so important? So clinical importance of that, my beloveds, you will be asked about that. So accessibility and legibility. Instant access to patient history, medications, allergies, lab results, imaging, eliminating issues with illegible handwriting. Eliminating issues with this illegible handwriting. So my problem, for example. Decision support, so each EHR, these electronic health records, often incorporate clinical decision support system, CDSS, that can flag potential drug interactions, allergies, or suggestive preventive care measures based on patient data. Workflow and billing, integral to daily workflow, ordering tests, prescribing medications, a little bit later about that, and essential for accurate billing and regulatory regulatory compliance. So challenges that can contribute to physicians' burnout, yes, we know that, due to, you have to say that, cumbersome interfaces, so very often. It's a serious challenge that can contribute to physician burnout due to cumbersome interfaces, documentation's burden, so-called note bloat, and alert fatigue. Understanding how to use your specific electronic health record efficiently and effectively is vital. Next point, it's about telemedicine. Actually, I was at the beginning in France in 1994, this telemedicine. So telemedicine experienced explosive growth and its reshaping care delivery, spurred by the pandemic, but building on decades of development. Telehealth, digital health, actually, telehealth, the broad term for remote healthcare services, telemedicine, specifically remote clinical services, and are now mainstream. This includes video consultations, remote monitoring and store and forward consultations, for example, sending images for review later. It's so important. So this is a question of access to care, dramatically improve success for patients in rural areas, those with mobility issues, or needing specialist consultations not available locally. Convenience and efficiency offers convenience for patients and can make certain follow-up of chronic disease management more efficient. New skill requirements, so requires developing website manner, proficiency, with virtual examination technique and understanding the legal ethical nuances. So license across state lines, privacy is a remote setting. Next point, healthcare data is a prime target for cyber attacks. We have to know that. So be careful. So right, all this patient health information is incredibly valuable on the black market. So healthcare organizations face constant threats from ransomware, phishing scams, and data breaches. The consequences of a breach are severe, involving hefty fines, reputation damage, and potential patient harm. Yes. So it's so important. So patient confidentiality, it's highly important. Protecting patient data is a fundamental ethical and legal obligation under regulations like for example, in the United States, it's a Health Insurance Portability and Accountability Act, HIPAA, Health Insurance Portability and Accountability Act in the United States. You must understand and adhere to security protocols, so strong passwords, avoiding unsecured networks, recognizing phishing emails. So continuity of care. A cyber attack, especially ransomware, can shut down hospital IT systems, including these EHRs, imaging systems and communications platforms, severely disrupting patient care, delaying procedures and creating safety risks. Then that you adore, it's artificial intelligence. It's increasingly used now in diagnostic and decision support. Artificial intelligence algorithms, AI. So AI algorithms, particularly machine learning, are being developed and deployed to analyze medical images, radiology, for example, pathology, interpret ECGs, predict patients' risk. No, I don't know. For example, sepsis, readmission, and identify patterns in large data sets that humans might miss. Why it's so important? Augmented capabilities. AI is generally viewed as a tool to augment clinician capabilities, potentially improving diagnostic accuracy, speeding up interpretation, and identifying subtle findings. Yes, it's right. Need for validation and oversight. Clinicians must understand the limitations of AI tools, the data they were trained on, potential biases, and retain ultimate responsibility for patient care decisions. So you need, my beloveds, to be a critical consumer of AI-derived insights, not just blindly accept them. Then ethical considerations raises questions about accountability, bias in algorithms, and transparency. About medical imaging medical imaging is almost entirely digital. Medical imaging now it's almost entirely. Film-based X-rays are largely a thing of the past. Medical images, for example, X-ray, computer tomography, MRIs, ultrasound are acquired, stored, distributed, and viewed digitally using picture archiving and communication systems. PACS, PACS, it's acronym, abbreviation, typically adhering to the digital DICOM, Digital Imaging and Communications in Medicine, DICOM, DICOM, standard. So it's a DICOM standard, of course. Clinical importance of that, so instant access and comparison, allow clinicians to view images instantly from anywhere within the hospital network, or remotely with proper security, of course. It's actually a big problem, big issue. And easily compare current images with previous studies. Collaboration, so facilitates easier consultation with radiologists and other specialists. Image manipulation provides tools for zooming, adjusting contrast, brightness, and making measurements which can aid interpretation. So understanding basics of this system, picture achieving and communication system, PACS. So understanding basics PACS navigation is essential. Then interoperability remains a major challenge. So interoperability is the ability of different IT systems and software applications, for example, EHRs from different hospitals, labs, pharmacies, to communicate, exchange data, and use the information that has been exchanged, while improving seamless interoperability is far from universal. Far from universal. So why is so important? So fragmented care, lack of interoperability leads to incomplete patient information. When patients move between different healthcare systems or providers, potentially resulting in redundant testing, missed diagnosis, or adverse events. Workflow inefficiencies. Clinicians often waste time chasing down records from other institutions or manually re-entering data. Yes. Public health implications make it harder to aggregate data for public health surveillance and research. So be aware that the patient information you see in one system might not be the complete picture. Next point, patient-generated health data, PGHD, is growing exponentially, this PGHD, patient-generated health data from wearable devices, smartwatches, fitness trackers, home monitoring equipment, for example, glucose monitoring, blood pressure cuffs, and patient-recorded outcome applications, mobile health, or so-called mHealth, mobile health, is increasingly available. Why it's so important? So potential for insight. So this patient-generated health data, PGHD, can provide valuable insights into a patient's condition between clinic visits, potentially enabling earlier intervention and personalized care. Data overload and validation presents challenges in managing the sheer volume of data, verifying its accuracy and integrating it meaningfully into the clinical workflow and this EHR. Engagement can empower patients to be more involved in managing their health, but requires clinical teams to have processes for reviewing and responding to these data. Yeah. Then clinical decision support system, so CDSS, are embedded in many workflows. So CD, clinical decision support system, are IT tools, information technology tools, designed to assist clinicians with decision-making tasks. They range from simple alerts, drug allergy interactions, duplicate orders to complex diagnostic suggestions or recommended treatment pathways based on guidelines and patient data with electronic health record. Why it's so important, my beloved, safety net can significantly improve patient safety by catching potential errors, for example, dosing and interactions. Anyway, guideline adherence helps promote evidence-based practice by reminding clinicians of relevant guidelines. Alert fatigue, overly sensitive or numerous alerts can lead to so-called alert fatigue, where clinicians start ignoring them, potentially missing important warnings. Understanding how to customize and interpret alerts effectively is a key. Now about electronic prescribing, now very fashionable, so ERX. Electronic prescribing, ERX, that dramatically reduces medication errors, highly controversial actually. So transmitting prescriptions electronically from the prescriber's EHR directly to the patient's pharmacy system largely replace handwritten or faxed prescriptions, often part of a larger computerized provider order entry, CPOE. system for all orders, labs, imaging, meds. What's the clinical importance of that? Safety. Eliminates errors due to legible handwriting, reduces risk of incorrect drug or dosage selection, often includes dose range checking, and allows for automated checks for interactions and allergies at the point of prescribing. Efficiency streamlines the prescription process for clinicians, pharmacists, and patients. Controlled substances. Increased mandatory for prescribing controlled substances in many regions to improve tracking and reduce diversion. So directly or directly, anyway. Patients portals enhance patient engagement and communication. So security online websites often integrated with electronic health record and that give patients access to portions of their medical record, lab results, visit summaries, medication lists, allow them to schedule appointments, request refills, and communicate securely with their care team. Why it's so important? So improved communication provides a secure channel for non-urgent communication, potentially reducing phone tag. Patient empowerment gives patients easier access to their health information, encouraging them to be more active participants in their care. Adherence and outcomes. Studies suggest portal use can be associated with better medication adherence, improved management of chronic conditions, and increased patient satisfaction. I can get no satisfaction. Understanding how to leverage the portal for communication and education is beneficial. So finally, my beloveds, information technology is an indispensable tool in modern healthcare. Fortunately, unfortunately, it's not a point. As a medical student, developing a solid understanding of the systems, their capabilities, limitations, and implications for patient care and your own workflow is crucial for becoming an effective, efficient, and safe physician in our times. Continuous learning in this area, not only in this area, will be essential throughout your career. So subscribe my Dr. Y YouTube channel. Don't sleep, my beloveds. I understand it's borrowing point, but anyway, topic. Actually about subscribing. Don't forget to follow and subscribe not only my Dr. Y YouTube channel, but my Telegram Dr. Y, WHY. Like Dr. Y, it's me. Dr. Y, WHY. Without question mark, of course. You type in searching mode Dr. Y, WHY, in Telegram, of course. It's a private Telegram channel. So you type in searching mode in Telegram Dr. Y, WHY. You click start and you choose your plan. So see you on my Telegram private channel. It's not costly at all.